muscular system. Muscular system in our body, we have three types of muscle: cardiac muscle, smooth muscle, and skeletal muscle. Cardiac muscle we will only find in the cardiac, in heart, and smooth muscle we will find in the organs, and skeletal muscle we will find in the skeleton. Okay, which is very important root in our body. Skeletal muscle, we have many types like unipinnate, multipinnate, and bipinnate muscle. Okay, and then we have fusiform muscle. But the most important in the first our topic today, we will discuss the muscle of the back. And muscle of the back, we have back muscle, simply back muscle, back muscle, back muscle. Back muscle, we have two groups of muscle: superficial and deep muscle. Deep, superficial muscle and deep muscle. Okay, these are the two groups which we find in the back muscle. Okay, superficial muscle. Our topics to discuss superficial muscle of the back. Superficial muscle, we have in three layers. Three layers we have muscle in superficial. Three layers. First layer we have. First layer we have this one muscle. This one means trapezius muscle. Trapezius. Second we have latissimus dorsi. And this is the first layer. Then we have second layer. Second layer we have rhomboid major. This one rhomboid major. Rhomboid major and rhomboid, the small one. This one is rhomboid minor. The second layer. Third layer, I will write you here. Third layer we have this one here, and also hide here in the behind the rhomboid minor muscle. Sorry, we are in the second layer. We also have one muscle more. This is levator scapulae muscle. Levator scapulae muscle. Levator scapulae muscle. Levator scapulae muscle. Okay, these are three muscles in the second layer. And first layer we have two muscles: trapezius muscle and latissimus dorsi muscle. Okay, and the third layer we have first, this is posterior serratus superior and posterior, because this is back side, which one is posterior serratus inferior. Okay, again repeating, three layers we have superficial muscle in the back muscle, in three layers. First layer we have this one is trapezius muscle. This is trapezius muscle. Then we have latissimus dorsi muscle. This is the first layer. Second layer we have rhomboid major, rhomboid minor, and levator scapulae muscle. And third layer we have posterior. This one posterior superior muscle, because upper side. That's why in back side we call it posterior in terminology. Posterior superior muscle and posterior inferior muscle. Now we will going to each muscle origination and insertion. Now we know superficial group of muscle of back in how many layers? Three layers. Each layers muscle we know. Okay. So, trapezius muscle, first layer muscle. Because remember, we are talking about superficial group of muscle of back. Okay. First layer muscle, we have trapezius muscle. Now we need to know the origination and insertion and function. We will discuss. Okay. Origin and insertion of trapezius muscle. Okay. First, I need to tell you is very important. You know, this trapezius muscle and trapezic muscle we divide into three parts. Okay, this one is superior part, this one is middle part, and this is the inferior part. Okay, superior part. First I will write here trapezius muscle into three parts. First part, superior part. Okay, superior part origination. Superior part origination from here. See here what we discuss in the bone, in occipital bone. Here what we have? We have superior knuckle line. Superior knuckle line. Superior knuckle line. And what we have here in the whole circle here, we have external occipital protuberance. External occipital protuberance. And then what we have? Another here we have in muscle we have here ligaments. Inside here is knuckle ligament, because in the knuckle area, we have knuckle ligaments. Okay, knuckle ligaments is origination of superior part of trapezius muscle. This trapezius muscle which we going to discuss, and this I already told we divide into three parts: superior part, middle part, and inferior part. Superior part origination from the superior knuckle ligaments. Then we have here external occipital protuberance and knuckle ligament. Okay, this is the origination. Insertion, if you talk insertion of superior part, insertion, where is inserted? Okay, inserted, if you know, when we discuss, this is a clavicle bone from, because this is a back side, and here we have the front side, we have clavicle bone, and we know in clavicle bones we have two ends, one is sternal end, sternoclavicular end, and one is acromion-clavicular end. Then the origination of here is a acromion process and acromion-clavicular end. Insertion in the acromion-clavicle end, and second is acromion process. This is the insertion of the superior part of trapezius muscle. Okay, then we have middle part. Middle parts we have here. You know, here, if you remember, I will going also discuss middle part. We have middle part we have here C7 vertebra origination. We talking in the C7 till T4. This insertion from C7 to T4 thoracic vertebra. C1 is cervical vertebra, T4 is thoracic vertebra. This is origination of the middle part of trapezius muscle. Then insertion here. You know, here we discussed the scapula. This is scapula, and here is a spine process, and here acromion process which we discussed. Okay, acromion process and spine process of scapula. This is the this is the insertion. So this is the insertion, and this is the origination. This is the origin of middle part, and this is the insertion of middle part. Okay, these are the middle part of trapezius muscle, origination and insertion, which we discussed. Now the third part of trapezius muscle. Third part we have inferior part. Inferior part we have inferior part origin from one T4 to from C1 to T4 we discussed middle part. Then now T4 to T12 we have inferior part origin of trapezius one, T4 to T12. Now insertion where? Insertion in the where? The spine process of the scapula. Spinous process of scapula. Okay, these are the trapezius muscle of the superficial group of back muscle. Then we have the first layer muscle, trapezius muscle, which we have three parts: superior part, middle part, and inferior. Superior part, we discussed knuckle ligament origination, external superior protuberance, and superior knuckle line. Then inserted into the acromion clavicular end and acromion process. Then we have middle part from originate from C7 prominence, which we know prominence vertebra, then going to the thoracic vertebra 4. This is origination and insertion into the spine process and acromion. Okay, acromion process. Then we have inferior part of the trapezius muscle, which starts from T4 thoracic vertebra until to the going to the T12 thoracic vertebra. This is the only origination and insertion going to the spine process of the scapula. These are the trapezius muscle of the superficial group of back muscle, which we discuss. Okay, next we have latissimus dorsis muscle, the second layer, the second muscle of the first layer. The second muscle of the first layer, you know, this is the first layer. Okay, the second muscle, latissimus dorsi muscle. Latissimus dorsi muscle. Dorsi muscle. Okay. This is the latissimus dorsi muscle. This one here. Okay. His origination from origin and insertion. Origin is very, insertion is only one, and origin from many parts. Okay. And here also remember, this is the thoracic fascia, thoracolumbar fascia. This is the white is thoracolumbar fascia, and this is the clavicular, hip ox hip bone. Okay, ilium bone part. Okay. Origin from T7 till T12. Okay. Then we have here, because here is thoracolumbar fascia, we will write thoracolumbar fascia. Then we have here helicrest, and here is also little bit part connection with the inferior angle of the scapula, and inferior angle of scapula. Okay. And then insertion is very small. If you remember the bone name which I told you in the class, you need to remember the bone, because when we will study the muscle, then you know, if you know the each part and the proximal, distally, and medial diaphysis, and you know formation, there is muscle attachment, and then it is very easy for you. Here, you know, this is here is the laterally we have greater wing, and lesser wing is a medially. Okay, then his attachment with the lesser tubercle. Okay, lesser tubercle of humerus bone. This only simple insertion of the latissimus dorsis muscle. We discussed two muscle is the first layer muscle, again repeating, trapezius muscle and latissimus dorsis muscle, which are starting from origination from T7 to T12, and also thoracolumbar fascia, which is the white, and then helicrest, and also a little bit area in inferior angle of the scapula, and inserted in the lesser tubercle of the humerus bone. Okay, this is the first layer muscle of superficial group of back muscle. Okay, of back muscle, like trapezius muscles and latissimus dorsi are helping the in the scapula to elevate. Okay, and when we are doing in the neck region, abduction and adduction, also helping in the this muscle helping. Okay, next we have second layer we have three muscle. Okay, which I discussed: rhomboid major, rhomboid minor, and levator scapulae muscle. Now we will the second layer of superficial, don't forget, superficial group of back muscle. Okay, now first rhomboid major, muscle. We will discuss origin and insertion. Okay, origin is, you know, here we have starting from rhomboid. Here also this is a rhomboid major starting from the 1 to T4 thoracic vertebra. Okay, this is the origination of the rhomboid major muscle, and insert into the, this is the scapula, which we know this is the middle border of scapula. If you remember the scapula bone, this is the middle border of scapula, but not whole, only two-third of middle border of scapula. Okay, then this is the rhomboid major muscle, which help in the to elevate the and retract the scapula. Okay, then we have second, rhomboid minor muscle, which origin and insertion. The second muscle of the second layer of superficial group of back muscle. Again, I am repeating you. Okay, which origination? Here we have C6 and C7. Origination from spine process. Also don't remember spine process. Okay, spine process of C6 to C7 vertebra, and inserted into the one which two-third is for rhomboid major muscle, and one area is remaining of middle border of scapula is for rhomboid minor muscle. Is called one-third of a middle border of scapula. Middle border of scapula. Okay, these are the second muscle, which rhomboid major and minor muscle. Okay, then we have the third muscle. We have levator scapulae muscle. Okay, it's very easy. Levator scapulae muscle. This third one here and here. Levator scapulae muscle. Yes, scapulae muscle. Origin and insertion. Origin from the, here we have now C1 spine process of C1 and C2 vertebra. C2 and C, you know this from the name, C1 cervical vertebra. Okay, and insertion into the superior angle of scapula. Superior angle of scapula. Now repeat this summary fast. Okay, we have second layer, we have three muscle. This one is rhomboid major muscle, which originated from the T1 to T4 thoracic vertebra and inserted into the two-third of the middle border of scapula. Okay, then we have rhomboid minor muscle, which originated from the C6 to C7 spine process and inserted into the one area which remaining after is one-third of the middle border of scapula. Then we have levator scapulae muscle, which originated from C1 atlas and axis and spine process of atlas and axis and inserted in the superior angle of the scapula. These are the second layer muscle of the superficial group of back muscle. Okay, very easy, and these muscle help to rotate and elevate the scapula. Now we have the third layer of the superficial group of back muscle. Third layer. Okay, and third layer we also have two muscle, which I discussed. If you remove the rhomboid major, minor muscle, there we have this one, and this one we have here is a serratus posterior superior muscle. Serratus posterior superior muscle, because it's upward. Okay, that's why this is origin and insertion. Okay, origin from the C6 spine process of C6 to T2 thoracic vertebra. Okay, C6 spine process C6 to T2 thoracic vertebra and inserted into the rib 2 to rib 5 external surface. Okay, because we know the external internal surface of this bony part of the rib, which we discussed in the bone. External surface. Okay, simply serratus posterior superior muscle, which we here located, and is originated from spine process of C6 cervical vertebra till to T2 thoracic vertebra and inserted into the rib 2nd to rib 5th external surface. Then we have serratus posterior inferior muscle here. This one. Okay, serratus posterior, because it's backside, inferior muscle. Origin and insertion. This is the third layer of superficial muscle of the back. Okay, simple origination with origination from here T11 till L2 lumbar vertebra till thoracic vertebra 11 till lumbar vertebra 2 till exerted we are in the 9 till 11th ribs external surface. Okay, external surface, which this origination, the third layer of muscle, serratus posterior superior muscle, originated from C6 to T12, T2 ribs, second to fifth rib external surface, serratus posterior inferior, the lower one, originated from T11, here T11 till L2 lumbar vertebra and inserted into 9th and 11th. Here this is the ribs, which I dotted. This is the black one. This is the ribs. There is this insertion. Okay, simple function. Serratus superior muscle, when they helping the ribs, the thoracic cage elevates downwards to help in expiration. Okay, and this the serratus posterior inferior help pulls down the thoracic cage to help, pulls down the ribs to help in inspiration. Okay, these are the very simple function of the serratus posterior and inferior and the third layer of the superficial group of back muscle. Okay, these are which we discussed. This is the whole superficial group of muscle of back, and in the three layers. Okay, first layer 2 muscle, trapezius, latissimus dorsi muscle. Second we have rhomboid major, rhomboid minor, and levator scapula, and third layer we have serratus posterior superior,